everyone, my name is Chelsea Hayden, and in this presentation I will be discussing the professional image of nursing, what shapes it, how we contribute to it, and how my role as a labor and delivery nurse influences the way I uphold and represent the profession. So my first point, depictions of nursing in entertainment and news media, is really important because the way that nurses are portrayed in entertainment and news plays a major role in how the public understands what we do and understands our profession. Overall, I don't believe entertainment offers a true, complete depiction of nursing, especially when it compares to my own reality in labor and delivery. For example, in shows like Grey's Anatomy or Chicago Med, nurses are often portrayed as helpers. They're kind of in the background where the show is really, the drama of the show is on the physicians and what they do for patient care. These scenes are highly inaccurate, especially in my experience in labor and delivery. Nurses are the ones that are continually monitoring fetal heart tones, assessing labor progression, coaching mothers through contractions, initiating emergency interventions, and communicating critical changes to providers. We are the ones at the bedside from minute to minute, making independent clinical judgments. So when you see these shows and you're only seeing the physicians 90% of the time and nurses are just kind of playing in the background, it's inaccurate. However, there is some news media coverage, particularly stories highlighting the nursing shortages, maternal health issues, or positive birth outcomes that do show nursing as an independent and essential profession. For example, I've seen reports covering nurse-led initiatives to reduce maternal mortality or highlighting the role of nurses in supporting patient advocacy during childbirth. These reflect the true depth of what L&D practice is and the autonomy that we have as nurses in labor and delivery. The accuracy varies, of course, across different media types, but entertainment tends to reinforce outdated stereotypes, whereas the news reports sometimes provide a more realistic view of what it looks like to be a nurse, especially in specialized areas like labor and delivery, I think. As for how I project professionalism in my workplace and a daily life, I try to practice it intentionally, both at work and outside. I represent myself in a way that I'm proud of, and I think that strongly impacts my patients and families in these really meaningful moments of their lives. So a few different ways that I do this. I am educating myself beyond my ADN and getting my bachelor's of science in nursing. Labor and delivery requires precise clinical judgment, really quick decision making, and strong evidence-based practice skills. So earning my BSN, I hope, will help me strengthen my ability to provide the safest possible care. Secondly, I try to introduce myself, or I should say I do introduce myself clearly as a registered nurse every time I meet a patient and their family. I wear my ID badge, and this helps to reassure families that they have a trained, educated, skilled nurse advocating for them and their newborn at this really intense period of their life. Additionally, I'm continually working to maintain and enhance my clinical skills, fetal monitoring, emergency responses. I just did a med sled training yesterday, updating certifications like my NRP. In labor and delivery, things can change really quickly and situations can become intense. So it's really important that I stay up to date on different trainings and also reflect on my professionalism in the nursing role by looking and completing these different additional trainings. So through these daily actions, education, clear communication, ongoing skill development, this helps me maintain a positive, accurate image of nursing within the hospital and also outside. Additionally, actions that promote a positive and accurate image of nursing. After learning more about the importance of maintaining a strong professional image through this course, I recognize several actions I can take to support both the nursing profession and my own growth as a labor and delivery nurse. One action I plan to do is to join a professional organization. There's a lot to choose from: the Association of Women's Health, Obstetric and Neonatal Nurses, Florida Nurses Association. These organizations promote high-quality maternal-child care, support evidence-based standards, and give nurses a voice in shaping maternal health policy. Another action I could partake in is responding to inaccurate depictions of nursing, especially those related to childbirth, which is the specialty I've chosen, whether it be through social media or direct communication with media outlets. When we let these incorrect portrayals of L&D practice appear, speaking out helps to correct them and advocate for the true depth of the nursing expertise. Additionally, participating in community outreach, such as speaking to students about nursing careers or participating in childbirth education events, these opportunities allow me to present a realistic picture of what nurses actually do during labor and delivery and help bridge the gap between public perception and reality. I can advocate for nursing at the workplace level, supporting safe staffing, participating in committees, and collaborating with the interprofessional team to enhance maternal outcomes and patient satisfaction. In conclusion, the professional image of nursing is shaped by many factors: media portrayals, personal actions, public advocacy, and our daily practice. As a labor and delivery nurse, I recognize that my actions play a particularly important role because I am often present during one of the most significant moments in patients' lives. While entertainment media often overlooks the autonomy, critical thinking, and expertise required in labor and delivery, I can help strengthen the nursing image by advancing my education, maintaining strong clinical skills, engaging in professional organizations, addressing misinformation, and advocating for safe and equitable maternal care. By continuing to grow, speak up, and represent the profession with pride, I can help create a more positive and accurate understanding of what nursing truly is and contribute to its advancement for future generations. Thank you for watching.